And so this site here is going to be able to handle between 800 and 1,000 vaccines a day. They have a online portal where folks are able to sign up, and they've already sold out all their reservations. But it's sumterfl.saferstart.net, and they're put in, offered this, and then as more vaccine comes, they have the capacity to expand this. And so we told them, if you're getting the shots in, we want to be able to send you more. And so I was able to talk to a number of the seniors here. Now at the villages, as many of you know, a lot of times you'd be just doing golf cart, but it's a little cold, so most of them are doing their car. I did see a couple in their golf cart. They thought it was convenient, but this is going to be something that is going to be convenient for folks. They said you come in, you do the shot, you wait. They were all very, very happy, and so we appreciate it very much, and I want to thank the villages. Now, these appointments are for seniors age 65 and older. Florida has made the decision to put seniors first when it comes to the general population. And most states, in fact, almost all states but a handful, made other choices. But I think it's interesting that there is a report this morning that HHS is now going to tell states, basically do what Florida's doing, focus on that 65 and up population. Now, they also have all these other young workers in line. I don't know how that's going to work, but the fact of the matter is putting seniors first was the right decision. If you look at Florida in terms of the number of shots that we have for senior citizens, we are leading the country by a country mile on this. And the vast majority of our shots have gone to people 65 and up, which is exactly what you want, because that is going to have the most effect on disease mitigation. And so when we had the opportunity, so you have the initial CDC recommendation, we didn't follow it because it would have allowed a 20-year-old healthy worker to get a vaccine before a 74-year-old grandmother or grandparent. That does not recognize how this virus has affected elderly people. So we're doing 65 and up. I think you're going to see now the federal government tell people that's a better way to be able to do it. But as of today, in the reporting on this lags, I think it's important for folks to know when it's reported that the U.S. has done 8 million, there's been 21 million doses allocated, but 8 million shots. Understand how that works. There's an allocation. Then it's delivered. It's not delivered as soon as it's allocated. I mean, there is a lag. Then it's administered, and then it's reported. So if you look back on Florida's reports, for example, on last Wednesday, the 7th, right now we logged 66,868 shots on that one day. But if you would have looked at that on Friday, it would have been about 52,000. Still very good, better, really our target. But they keep getting added. It is not instantaneous reporting. And so I would bet that if the number is 8, 9 million, I bet you it's well over 10 million nationally because of the lag on this. So just understand how that works. But as of now, even with the delayed reporting, we're reporting almost 350,000 seniors that have received a coronavirus vaccine shot. And again, there is no other state that is even close to us in terms of going for seniors. The vast majority of our total vaccinations are going to seniors, and that percentage is going to grow more disproportionate in favor of seniors as we get through the next many, many weeks. And if you look at we got the vaccine mid-December for just 5 hospitals and nursing homes, and that mission has been underway. The hospitals, by and large, have gotten a lot of their staff. The next round to the broader array of hospitals was right before Christmas. There weren't a lot of vaccinations Christmas Eve, Christmas, New Year's Eve, New Year's. So last week was really the first full week where everyone was back in the saddle. And if you had asked me at that time, Governor, what would be your goal for a day, to get shots? I would have said if we could do 50,000 shots statewide in a day, that would be a really good start. But if you look, we averaged more than 50,000 Monday through Friday last week. On the 6th of January, we've already registered 61,348 shots on that day. On the 7th, we're registering 66,868 shots. And again, that more could be added to that because of the delayed reporting. So that shows the throughput that shows that we're able to work with the hospitals who are really doing a good job, do innovative partnerships like we're doing with the villages. We've had a great pilot with public supermarkets. We're going to have more announcements on that later in the week. And so that was a really good first full week in action in terms of the general public with the seniors. And so we're going to keep doing that. We really feel that this 250,000 that's hits yesterday and today, we have no doubt that that's going to be able to be used, put into the right hands. And so the question is, can we get more vaccine? They are also thinking about just releasing more. So what they've done up to this point is anyone that's gotten a shot up to this point, there has been a shot that's basically held in reserve by the federal government. And so when it's time for the booster, they then send the booster. So if a hospital has done 10,000 shots 3 weeks ago with Pfizer, they're going to get 10,000 booster shots to be able to do that. And I said last month, I was like, well, maybe you just, because we know there's going to be more production, maybe you just get as many out as you can, and then as more comes in, you're going to be able to fill the boosters. Now it looks like that may be what they're doing. So we're going to be ready to move on that. Obviously, we'd have to make decisions about where those extra shots go. We're not doing the booster, though. I think it's just important to know if that's the direction they go, you got to do the booster. The first shot does help. It does provide some protection, but to get that 95%, you got to do the booster. But I do think that there's ways, because the production is going to continue to increase, that you're probably going to be able to get that first shot. And then what happens, I guess, if you do it, the worst case scenario would be you get into like late February and you need Moderna boosters and there's not quite as many produced. Then you would do boosters and you may not be able to do as many first shots at that time, but that's kind of a worst case. Meanwhile, you're doing a lot more shots earlier. So we'll see how that works out, but I think we're prepared to do either way. I did ask, though, regardless of whether they're holding anything back, if you can get Florida more, we have the throughput to be able to get the shots in seniors' arms, and that's really what we're going to be doing. I was this weekend at Publix and some of their locations. We did 3 counties to start, Marion, Hernando, and Citrus, and they did 22 different stores across those 3 counties. They average between 100 and 125 shots a day at each individual store. They have a great system. We were able to go do it. There's pluses and minuses on how you do all this stuff. I mean, obviously, a site like this is great for the villages because a lot of people live here. But there's other parts of Florida where just putting a central location, there's a lot of seniors that may not live close to that. So when you're able to get it at a place like Publix, where that's in neighborhoods all across Florida, you're providing easy access for a lot of elderly people to be able to get it. And I was able to talk to a number of seniors, and they were very, very pleased with how the Publix process went, how easy it was, and obviously how friendly and nice everyone was about doing it. So we believe that that's been a very successful partnership, and we're going to have announcements about how we can expand that partnership throughout the state of Florida. We're one of the first states to take a major test site and transform it into vaccinations. And so we did that down at Hard Rock Stadium in Miami. Even though they had the national championship game yesterday, we told them we still want to do shots, and so we were able to do it at the end a little earlier, but we kept it up, did it all weekend, and so that's gone really, really well. People are happy. It's been something that's been getting 1,000+ shots a day through there, and the capacity to expand even more. We have partnered with local governments, county health departments, so you have 46 community vaccination sites throughout the state of Florida. I was also in Bay County Sunday. We partnered with a number of places of worship and had it all over the state. In Bay County, there was like 10 African-American churches that all came together to be able to offer vaccinations for those seniors there, and we're going to continue to do things like that. So we really believe that this is another great step. We were engaged with the villages very early on. We told them, we want to be partners, and they were ready to go, and they said, look, we're going to make sure we get it right. And so they really did a lot of legwork to get here, and I can tell you everyone is very, very happy. So we want to keep that up and make sure that we're continuing to do it. So seniors first is our mantra. That's our mission. When we get through that and we get it offered to every senior who wants it, then we'll be able to move on into the next phase. But we're going to continue to put seniors first, and I think you're going to see other states start to follow suit as well. Any questions?
Can you help us with the math a little bit? CDC's website says 1.6 million doses distributed in Florida.
Well, that includes booster shots, I think.
So is this a lag in the reporting with the numbers of what we've given and what their site says? And can you also address how you're paying nursing homes and if you will ever require residency here in Florida for people to get shots? There's some talk that are people coming out from Canada and other states to get shots here in Florida.
Well, we're not doing any tourists. Some of these nursing home people may live here 6 months of the year, so that's a little bit different. But we're not. We have people all over the country because we put seniors first, and because people actually see shots going in arms. You have literally people all over the world and all over the country calling here to see, and we're not doing that. We're not doing it for tourists. We're not doing it for interlopers. But I think that does tell you something. If we weren't getting the shots in the arms, people wouldn't be trying to come to Florida. I mean, that's just the bottom line. Now, on the reporting, so I think that includes booster shots. But it also, once something is allocated, that doesn't even mean we have it yet. I mean, so there's an allocation, then there's a shipment and receipt and distribution, then there's a shot, and then there's a reporting of the shot. And so if you look at what was reported for yesterday, for example, this morning, check that date tomorrow, it'll grow. Check the date the next day, it'll grow again. So I think in Florida, we're going to get 250,000, or we probably have gotten it already, or today we will have received 250,000 new first doses. We will do that this week without question. And so we're doing at a clip that's exceeding what we're getting right now. I think some of it for the first week was just the fact that we sent to hundreds of hospitals for their staff, and not all the staff wanted it. I mean, there's a real variance. Some staff was 75% of nurses. Some hospitals, it was like 33% of nurses. So if you look, there's hundreds of hospitals. Some may have 200 doses. Some may have 500. Some have a couple thousand. They are all now, I think, moving to get that out in the community. But I can tell you from what we're getting, we're going to get it out. And I have capacity to get more out with some of the throughput that we have. So you're going to start to see that across the country continue to pick up. But some of it, just understand, if you really want to know what happened yesterday, you probably got to wait a week for all those to be able to report it. In the nursing homes, the CVS, they do usually 72 hours, and that's the way it goes. You ask how we pick nursing homes. At the start of this, CVS and Walgreens was contracted with the feds to handle that. So we were going to just allocate that and then focus on the healthcare and the general public. Then they weren't quite ready the first week, so we activated strike teams. We went to over 100 nursing homes. In 6 days, we were able to vaccinate all the residents and staff who wanted it. And we did Pinellas and Broward. And the reason we picked that is because they have a high concentration of elderly nursing home residents in both of those counties. So we did that. Then CVS and Walgreens kind of took the reins from there, and they basically go, the nursing homes sign up, and then they go and do it. But what I also did last week was say, we have almost 4,000 facilities. Not all of them are skilled nursing homes, other long-term care. We want to be able to get that done as quickly as possible. So CVS and Walgreens was working through there, and we said, you know what, we're going to get all these assisted living and all these other facilities. So we have teams going through and doing that as well, and it's basically whoever asks for it signs up, you do the consent forms, and you get it. And so I think that you're going to see, hopefully, that come to a conclusion, relatively soon. No, I think that's right. I mean, that's why I said, if I have more vaccine, I can send to Orange County. I can send to Miami-Dade. I can source the villages. We know who's able to get it out now. I mean, I was at Orlando Health last week. They were like, I think I can do 10,000 this week. And then they started doing it. They're like, I can do more. Send us more. So this week they're getting more. So we absolutely can do it. But like I said, when you sent it to 300 hospitals or 200 hospitals, however many we did, it makes a difference. If you have 100 doses here, then 500 here, you know, that starts to add up in terms of that. But I think almost all those hospitals at this point are done with their staffs, and I think that they are reaching out to the community. Some of them did a great job. I mean, Orlando Health, Jackson, and in Miami-Dade, you know, you got Tampa General. I know they're going to be they're ramping up, so there's going to be a lot going on. So if you just gave me an extra 100,000, I could go to Orange. I'd say, how many can you do, you know, in the next 5 days? All right, we'll give you some. Can you guys add another lane here at the Villages? All right, you know, we're going to give you some. So we're at the point now where we understand who's getting it out, and you're going to give it to them. So, but those initial doses with the hospitals, there really was, no one really knew how much buy-in the staffs were going to have. And it does vary. I mean, Orlando Health, their nurses, 75% took it. I could tell you other parts of the state, it is way less than that. So that makes a difference. I mean, because they have a lot of employees at these health systems. So all that, I think, is being sorted out. And now really the focus, pretty much, I think in every hospital at this point, is those senior citizens and the elderly. And, you know, just get us the vaccine. We want to get it to you. And seeing the numbers, when you're almost 70,000 one of the days last week, if you would have asked me, would you 50,000 a day? Would you be? I would have been happy with that. So the fact that we're already showing we could do 70,000, and I really believe, you know, we can probably, you know, hit even more, you know, if we got it. So we're asking for more. We do have the throughput, and just understand the reporting lags. And so you will see across the country, it's not just a Florida thing, you will absolutely see those numbers go up. Whatever's reported by HHS or CDC today, I bet you there's 10, 15, 20% more shots that have actually gone in arms by 9 a.m. this morning than what's reported just because of the lag. So what we can do is the sites that we're involved in, we can tell you, okay, Hard Rock has already done 50. We could ask them, how many have you already done? We could keep the running tally. We don't know until they report what the hospitals are doing. And so they do it, they report it. Many of them are doing a good job reporting, but we, on our sites, we really try to report quickly. So for example, when I was in Bay County, we had a lot of the African-American churches there, seniors. I had National Guard people stationed there who, after the shots went in, they were putting it into the system and reporting it in real time. So that showed up on Monday's report for Sunday. Most places that are doing shots on Sunday, it probably isn't even going into the system for another couple days. Well, I mean, I don't want to see that, but if anything is disorderly, we are going to act very quickly. Don't worry about that. When I came out with our legislation in September, I said, look, Florida handled this summer well. We didn't tolerate it, but this stuff is happening in our country. We just have to understand it, and I don't care why you're doing it. You're not doing it here. So if there's any type of disorder, we will have the reinforcements there. I don't know that I've gotten anything specific for it, but that would not be advisable for people to want to do that in state Florida. And understand, our legislation is going to pass this legislative session. So if you riot, you are going to jail, and you're going to have to spend time in jail. If you assault law enforcement in a violent assembly, you're going to definitely go to jail. You burn down someone's business, you do all this, the penalties are going to be very swift and immediate. And I think once people see that, well, I think they already know Florida means business, but if people understand that, and I actually am glad to see some of these people getting arrested from the D.C. thing, because I think that the prosecutions will really make a difference. All right, I got one more. Yes, ma'am.
Those people who were arrested are from Florida, Governor. I mean, the president committed a crime last week during this whole situation.
Look, I think it was a really unfortunate thing. I think that a lot of the people that probably went to that speech were just going to do what they normally do. But those folks who took it to the violent level, they need to be held accountable. It's just unacceptable to do that. And, it was really, really a sad thing to see. But I'll tell you this. I know there's been criticism because, they should have had more police and all this. And that's a decision that someone higher up could make. I can tell you those Capitol Police on the ground, that was a very difficult situation. And they could have done it in a way that you would have had a huge number of people. die as a result of that. And I know that there was injuries and there were unfortunately fatalities, but I think those guys deserve a lot of credit in a situation like that, to be able to steer a huge mob of people away from doing a lot of other people harm. So good on them. And that's one of the reasons why I did the anti-rioting legislation, because I thought it was a way that we're able to stand by our law enforcement. And when they're in those situations, you got to have their back. And so I was a congressman for 6 years. Those folks on Capitol Police, always did a good job for us. Hell, I was on the baseball team when the guy was shooting Steve Scalise. They saved Steve's life, and they saved a lot of other lives. And so they have my gratitude for that. Thanks, guys.